Hello friends, welcome to the pre-course discussion session of second BNB course to be held on 28th and 29th July 2017. The topic given to me for discussion is graft choices for ACL reconstruction. I am Dr. Sudeep Vaidya. My moderator friends are Dr. Shailaj Ranjitkar and Dr. Nirav Kayast. Before we talk about graft choices, let us know what is ideal graft for ACL reconstruction. It should replicate the anatomical and biological properties of native ligaments, guarantee a safe and long-standing fixation, provide rapid biological integration, and it should have low donor site morbidity. Graft choice. Actually, at the present there is no single graft that will fit into all kinds of patients that requires ACL reconstruction. That's why there is no one size fits all. So the decision is based on age of the patients, size and gender, physical demands, associated injuries, degree of laxity, patient's anatomy, patient choice and expectations, ultimately the surgeon's preference, experiences, and belief. Types of grafts. We have autograft, which is most commonly used, then allografts and synthetic grafts. What are the autografts? We have bone patellar tendon bone grafts, which is still considered the gold standard and which has stood the test of the time. Then we have a hamstring tendons graft, which is becoming more and more popular at present conditions. And we have quadriceps tendons, which is also good choice, but at present it is mainly used for revision ACL surgeries. Advantages of autografts are it is being immediately available, biological healing potential it has. Of course, there is no additional risk of disease transmission, and it has without any additional cost. The commonly available allografts are tibialis posterior, tibialis anterior, peroneus longus, Achilles tendon, hamstring tendon, and patellar tendon. Let us see advantages and disadvantages of allografts. The advantages are it has no donor site harvesting morbidity. Definitely there is less operative time because the harvesting time is not there. There is no limit regarding number, size and shape. So if situation arises, we can have any number and size of them provided it is available. Disadvantages are it has a potential for disease transmission. It has higher costs. It has longer healing time frame, and there is definitely increased risk of failure, particularly young patient and the irradiated grafts. Indications of allografts. Athletes that might be affected by the harvesting symptoms and functional deficit. Look at the picture. The winner is bold. And if the autograft is used, even the slightest amount of hamstring weakness or anterior knee pain can result into his performance. It is also used in ACL revision surgeries and complex multi-ligament reconstructions. Current scientific evidence between autograft versus allograft shows no significant difference regarding re-rupture rate, clinical, functional, and subjective outcome. Let us see Few things about synthetic grafts. Concerns over auto and allograft has led to the development of synthetic graft. It became quite popular in 1980s and early 90s. First and second generation had significant unsatisfactory results like early breakage, elongation, inflammatory synovitis, etc. Therefore, it was discontinued. The third generation synthetic graft has knitted extraarticular portion which resists elongation but without brace to reduce debris. Currently used synthetic allografts are ligament augmentation reconstruction system (LARS). At the moment, their remains controversial and it is not commonly used in our part of the world. Let us see a little bit about the evolution of graft. In 90s, if you see, the BPTB was very popular, and as you go from 90 to 98, semi-tendinous graft became extremely popular. Let us talk a little more about BPTB and hamstring because these are the two grafts which has been used all over the world, and we'll see what are the advantages and disadvantages they have. BPTB, historically considered gold standard because of its excellent clinical result and high level of patient satisfaction in long-term follow-up. Advantages are excellent initial fixation with inference screw and bone-to-bone healing. Definitely there is ease of harvesting, high strength and stiffness, and consistency of size. Long-term results, 17 to 20 years, showed stable, normal or near normal function. Only 1.6% needed revision. BPTB has its own disadvantages. They are patellar tendon rupture, patellar or tibial fractures, quadricep weakness, loss of full extension, anterior knee pain, difficulty in kneeling, numbness due to inflamed patellar branch of saphenous nerve injury. Hamstring graft. One of the most commonly used graft for ACL reconstruction at present scenario. Semitendinous with or without gracilis is used. It is used as a quadruple and comparable with the native ACL. Advantages are no fear of fracture of patella or tuberosity avulsion. There is no or minimal donor site morbidity. Ease of harvesting. Hamstring has average load failure of 22,422 Newton as compared to 1,785 Newtons in BPTB. Disadvantages of hamstring grafts are reduced knee flexion strength, inferior fixation strength, sciatic and saphenous nerve palsy, which is quite rare. And here the long-term result of hamstring tendon graft up to 15 years showed 75% scored normal or near normal result. Re-rupture rate was 17%, while short-term results showed 86 to 91% normal result, and only 1.5% had a re-rupture. BPTB and hamstrings are the most commonly used graft at present. So still there is a lot of controversies. There are some school of thought, they think BPTB is still the gold standard and they want to continue with that. But with the better method of fixation, hamstring tendon is becoming more and more popular at present scenario. So we try to review article which was published in Asian Journal of Arthroscopy 2016. We show is there any winner yet between BPTB versus hamstring tendons. So here 285 articles were reviewed 51 articles either compared or meta-analyzed. There were 9 meta-analyses among 51 articles and 3 systemic reviews. And also some relevant journals were reviewed. BPTB versus hamstring tendons. Most of the article had main area of comparison using functional outcome, donor side morbidity and complication after harvesting, stability, rehabilitation, osteoarthritis risk, and failure rates. Functional outcome was based upon Latham knee scores, Trenegar activity level, International Knee Documentation Committee scores. And the conclusion was both the grafts are equally effective in terms of restoring functional ability. No difference in functional outcome. Donor side morbidity and complication of graft harvesting. BPTB group had knee pain, extension loss, quadricep power loss, patellar tendinitis, graft rupture, and patellar fractures. And hamstring group had loss of flexion strength, injury to infrapatellar branch of saphenous. Stability was assessed by using Lachman test, pivot shift test, and KT1000 arthrometer. The result was when two-strand hamstring tendon was used, it showed statistical difference in KT1000 and pivot shift, but there was no difference in Lachman test. When four-strand hamstring graft with endo button was used as a fixation method, it showed near normal Lachman test, pivot shift, and KT1000. There was slightly higher degree of laxity in hamstring group compared to BPTB. The Cochrane review shows BPTB has a better stability but insufficient evidence. When rehabilitation was compared, BPTB group showed rapid incorporation with graft healing to bone was in 6 weeks, had a potential for accelerated rehabilitation. The hamstring graft had a little longer healing time, that was 18 to 12 weeks. So definitely the rehabilitation time was accelerated. The result showed short-term result was mixed for quadriceps strength, but long-term study showed no difference in quadriceps strength in both the groups. Osteoarthritic risks were also compared. The radiographic assessment showed no significant difference in OA changes in short term in both the groups. In study by G et al. Showed OA risk was 61% greater in BPTB group. But the explanation given was early arthritis could be due to the associated meniscal and cartilage injury, and late onset arthritis requires much longer follow-up. So again, the conclusion was not there. Failure rates. No obvious difference in failure rates between hamstring and BPTB group in long term. Few studies showed reduced failure rates with BPTB. Long-term follow-up showed equal success rate. Note, fixation modality and anatomical placement of ACL is also most important responsible for low failure rates. These are the conclusions drawn by different studies. The G et al. Knee 2015 study showed insufficient evidence to establish superiority of the either graft. There was one more study by Z et al. Which was published in European Journal of Orthopedic Surgery and Traumatology 2015. It shows more studies are required before drawing a reliable conclusion. There was another study by Lee et al. Archives of Orthopedic Trauma 2012. It also shows insufficient evidence to favor either. There was another study by Lee et al. 2011 showed post-operative complications were lower for hamstring than for BPTB, and BPTB were superior to hamstring in resuming stability of the knee. So if you look at the various studies, they are yet to give the final verdict. To conclude, at present there is no consensus regarding autografts versus allograft and BPTB versus hamstring tendon. But remember the concept of no one size fits all. That means we surgeon should be aware of all the graft choices that is available to us. Let us not say that I use only BPTB or I use only semitendinous or I use only quadricep tendon. So we should be aware of all the grafts. As per current review, BPTB and hamstring tendon both achieve good functional outcome. BPTB may offer more stable knee, but hamstring tendon with new fixation modalities may offer same stability. So at the moment, there is no winner at the moment. More robust studies are needed in future. Disadvantages of hamstring grafts are reduced knee flexion strength, inferior fixation strength, sciatic and saphenous nerve palsy, which is quite rare. And here, the long-term result of